Good afternoon and welcome to our daily media briefing. You're going to notice some changes that we're employing today. Obviously, people at the Emergency Operations Center are all working very diligently and hard and in order to ensure that none of them come down with the COVID-19 virus. They're all going to be wearing their own facial coverings. Now, these coverings are not N95 masks. They're ones that are made at home. They're bandanas. They're scarves. But it really illustrates the point that anybody in their home can find something that they can convert into a facial covering. As we've mentioned the past couple of days, April is certainly a very critical month in the fight against this virus. And I want to give a thank you to the National Association of Counties, because what you're going to see in front of you now is an illustration of the spread of this virus as it continues to today. To give you a visual illustration, we have this heat map which shows a rapid growing of the new COVID-19 cases throughout the country. There's over 3,069 counties across the United States, and these are cases that have been identified from February 15th through April 2nd. As you can tell, it's kind of a scary story, like something out of a science fiction movie. That's just from the last 6 weeks. And April could see an even greater exponential growth if we don't heed the public warnings and take the appropriate actions. That is why we are continuing to update our public health order and continuing to implementing new measures so we can prevent this virus from spreading more and infecting our community any further. And to prevent the spread, please heed these important steps. Practice social distancing. Avoid touching your face, your nose, your mouth. Cover your face if you go outside. And of course, stay at home and don't go out unless it is absolutely essential. Now today we're going to have Supervisor Fletcher give an update on our informational charts that we've been sharing and explaining in greater detail the updates to our public health order that we announced yesterday. Then we'll have Jeff Rossman, the president of the San Diego County chapter of the California Restaurant Association. Yesterday, we announced our updated public health order regarding employees at essential businesses wearing facial coverings, and we added restaurants to that order. Jeff is here to talk about what restaurants are doing to ensure food safety during this crisis. We're fortunate to have a great partner in the Restaurant Association, and I want to thank them and our restaurant industry for working so very, very closely with us in making sure that we continue to do the right thing, but at the same time we support our restaurants that are doing a great job. After Jeff, we'll have Dr. Wooten give us a medical update, and then we'll take questions. And with that, let me turn it over to Supervisor Fletcher.
Thank you, and good afternoon. Today, the County of San Diego passes 1,000 positive coronavirus cases. While expected, this moment should serve to reinforce to us all the difficult road ahead, the seriousness of the challenge we face, but most importantly should serve as a call to action, a renewed focus and a commitment to have this moment, the point at which we pass 1,000 cases, not be a reflection on what has happened over the last month, but rather as a motivator for what we must all do in the month to come. We have talked a great deal about the important role that April plays in the efforts as we move forward, where we must fully commit to flattening the curve. While we expect the cases to continue to increase, each and every one of us has a role to play in having this next 30 days be the defining moment for our region and the point at which we will chart our trajectory of if we end up like a jurisdiction like Italy or scenes we're seeing out of New York, or if we make it through under the capacity of our healthcare system. And the actions on each and every single one of us are the ones that are going to determine what the future holds for San Diego. After yesterday's press conference, we received a number of questions about the order, and we are in part asking for the public's continued patience in an ever-changing situation and an ever-evolving challenge of confronting coronavirus. Our guidance, our instructions, our public health orders, they will continue to change as well. We must every day adapt to the latest information. We must adapt to the newest opportunity to protect one another, and so we will continue to provide updated guidance. We also know in a world and an economy as complex, with as much information as flowing, that at times it is really important that we continue to reiterate this advice and guidance to try and provide clarity for the public so that they know what the expectations are on what they do. So I'm going to briefly walk through the 3 sections of the order that we provided yesterday. The amendments to the order from Dr. Wooten first talked about physical distancing and sanitation protocols for all essential businesses who are open. Essentially what this order does is say if you are an essential business as defined by the governor's executive order and you are open for business, then you must post outside your facility by Tuesday morning your physical distancing and sanitation protocols and policies. If you go to our website at coronavirus-sd.com, you will see a link that says Social Distancing Plan for Businesses. This is a template. It is a guide. You can use this template and guide in filling it out. I have a copy of it here. You can simply fill in the blanks and post yours, or you can create your own. But we are first asking all businesses that remain open. If you are open today, you should only be an essential business. And if you are open, by Tuesday morning, you need to post outside your location and provide a copy to all of your employees of your plan for physical distancing and sanitation protocols. And again, we've provided guidance to that effort. The second part of our order related to face coverings. And first off, we want to be clear that face coverings are distinct and different from medical masks. A medical mask, whether it's a surgical mask, an N95 respirator, a medical mask is something that belongs in a medical facility. And we continue to ask the public, if you have those, please provide those to medical facilities or to the County of San Diego, because those are the workers who need that level of protection most. A face covering is something as simple as a bandana. It is something as simple as a gaiter. It is something as simple as taking a sheet, tearing it in parts, and wrapping it around your head. And so a face covering is something that each and every one of us can acquire or make on our own. And for the broader public, we have not issued a legal mandate or requirement that you must wear them when you leave your home. But we are issuing a strong recommendation that you should. It has the potential to protect yourself, but perhaps more importantly, it has the potential to protect others. And so we are asking folks to wear a facial covering, not a surgical or medical grade mask when they go out, anytime that you leave your house. Now, we are having a requirement for the employees of a handful of categories of essential businesses only, that the employees of grocery stores, pharmacies or drugstores, convenience stores, gas stations, and restaurants, the employees of these 5 facilities, those folks shall wear a face covering while they are at work. Again, to reiterate, the businesses that are covered by a requirement that your employees must wear a face covering while at work are grocery stores, pharmacies and drugstores, convenience stores, gas stations, and restaurants. Restaurants were added after our press briefing yesterday. And I actually want to take a moment to thank the Restaurant Association. You're going to hear from Jeff in a minute. The Restaurant Association reached out to us and said, we would like to be included in this order. We want the public to have full confidence that we are doing everything that we can to protect them and protect all of us. And we're grateful for the Restaurant Association and the other business leaders that stepped up and said, we know that it is quick, we know that it is something different, but we want to be a good partner and we want to comply, and we are grateful for that. So again, for the broader public, it is a recommendation, something we strongly recommend and we encourage you to do to cover your face when you leave your home. For these 5 entities of essential businesses, grocery stores, pharmacies, convenience stores, gas stations, and restaurants, starting at midnight tonight, you must have face coverings for your employees. The third part of our order related to parks, recreation centers, and beaches. We have a public health order in place today that says each jurisdiction can decide if they want to have these facilities remain opened or closed. If they can ensure physical distancing, and if they have a sanitation protocol and plan, then individual jurisdictions can choose to keep parks and recreation centers open. However, county-wide, all parking lots of these facilities must be closed. Additionally, all of these entities, parks and recreation centers, either have to have a sign up that says they're closed, or if they remain open, they have to have a sign up with their plan for physical distancing and sanitation, just like all essential businesses who remain open. The aim here is to ensure that those jurisdictions that keep them open have a plan and protocol to comply, and by closing the parking lots, we believe that we can lessen the gathering and we can lessen folks traveling from one entity to another. The reality is you shouldn't be driving to a park or recreation center. If there's one near you and you can walk to it, then that is okay. Our public health order also distinguishes between active recreation and passive recreation. Passive recreation, hiking, walking, biking is allowed in those jurisdictions, centers that remain open. Active recreation is not. Basketball, volleyball, football. Included in active recreation are swimming, surfing, and recreational boating. All of those activities are prohibited county-wide. That goes in effect Monday at midnight. With those three orders having been covered, let's get into our charts and updates quickly. The first one you will see here, as I alluded, we had an increase of 146 cases, which brings us to 1,112. Again, expected change, but change that should reinforce and remotivate to all of the public the vital importance that the coming days play. Number of tests, we are now over 15,000 tests that have been conducted in San Diego County, with a daily increase of more than 1,800. Again, the day-to-day numbers do not reflect a great deal. It is the broader trends, and the trends continue to show a positive increase in the number of testing available in San Diego County, a trend that we would like to see continued into the future. The next chart here really represents graphically the difference between the increase in testing and the increase in the number of positives. As we've seen our daily increase in the number of testing go up, we have seen an increase in the number of positives, but there is, of course, some encouragement here that there is a vast difference between the number of tests being conducted and the positive cases being reported, and we hope to see this trend continue. Likewise, on the next chart, you'll see a comparison between the positive tests, the number of hospitalizations, ICU hospitalizations, and the unfortunate loss of life. Again, you can see that although all of these trend up, we are continuing to be able to maintain the healthcare capacity of our system for the time being. Next slide, you see our outreach efforts increase in 211 calls. 211 is doing a heroic job, and we are working to continue to support them more. Increase in calls to the nursing line, our epi calls. The hygiene kits, I just want to take a second and talk about this because we're now over 2,000 hygiene kits that have been distributed. Here you see individuals who are assembling these hygiene kits. They have water, hand sanitizer, information about coronavirus, soap, a variety of things. These are being distributed by the San Diego Police Department officers, PERT clinicians, health and human service specialists with the Central and South region, and they are out every single day encountering the unsheltered, making sure that they know available services that are there, screening for individuals with symptoms, and encouraging positive hygiene efforts as we try our outreach efforts with all of San Diegans, regardless of their housing situation. Next chart is the number of motel rooms. Our public health motel rooms, we begin to see an increase in the occupancy on those, along with the rooms that we have transferred to the Regional Task Force on Homeless for vulnerable seniors. Next is personal protective equipment. Again, this is a very important statistic and chart. We are now approaching 1.4 million items of personal protective equipment that have been distributed to date. These are individual items that have been provided to our healthcare partners. You see an increase in N95 respirators, surgical masks, face shields, goggles, gowns. We continue to aggressively acquire as many supplies as we can and to get out as best we can to those what we believe they need. Final slide on charts is ventilators. We've talked about the vital importance that ventilators play in a response to the coronavirus. I am pleased to report that all 23 of our San Diego-based hospitals are reporting their numbers, and we appreciate their help and cooperation and coordination. There's an increase in the total available today of about 100. Again, day to day, you can't read a lot into that other than we have full participation, and we presently have ventilator stocks. We have an increase in our ready reserve that are ready to deploy at a moment's notice, and we continue to await the shipments of those we've ordered, along with further guidance from the state of California on what we can expect to receive from them. The very last point that I want to make is an important one, and that I want to give a particular shout out and appreciation to all of the county workers who are in our Emergency Operations Center. These are the individuals who you don't see on a daily basis, but those of us here see. We see their commitment, we see their professionalism, we see them coming in and day out. We appreciate the sacrifice that they give. We appreciate their families' patience. And I will tell you, as a combat veteran of the United States Marine Corps who did multiple deployments, I have never worked with a better team than those county individuals who show up at our Emergency Operations Center every day, fully committed to the task of protecting the public. And I couldn't be more pleased to be a part of this team. And I'm incredibly grateful for each and every one of them and the aggressive nature that they bring in doing everything we can to serve San Diego. With that, I'd like to introduce Dr. Wilma Wooten for our public health update. With that, I'd like to introduce Jeff Rossman from the San Diego Restaurant Association to provide some comments. And again, just to reiterate how much we appreciate the Restaurant Association. We put a lot of demands on them. We do that on a daily basis through our Department of Environmental Health in terms of ensuring the safety of our food system, but in particular to have an industry reach out and say, we want to be a part of more protections, and we will joyfully be there because we want to be a part of the solution. We are incredibly grateful to the Restaurant Association and to Jeff for joining us.
Thank you, Supervisor Fletcher. I think you can all tell that I'm a restaurant guy because I'm using linen napkins work as facial coverings. First and foremost, on behalf of the California Restaurant Association San Diego chapter, we want to thank everyone at the county. We want to thank our heroes, doctors, nurses, all the first responders, everyone being out there on the front lines. You're doing an amazing job. As you heard last night from the order, we immediately contacted the county health department as a restaurant association and wanted to be involved in the order. We feel that restaurants and the restaurant industry are an essential service to be included in the facial covering guideline. We want you to know that our restaurants are committed to operating safely. As a restaurant chef and owner of Terra American Bistro and Buns Burger Joint, safety and sanitation is on my mind every day. Restaurants are actually the safest places to be on a day-to-day basis. We're under the guidance of the Department of Environmental Health daily. We're regulated by their guidelines. We've stepped up our protocols even more as the CDC guidelines and our local health officials. My hands, I usually wash my hands about 100 so times a day. Now it's even 300 times a day. We had our chemicals were increased, our parts per million, our sanitizers to about 400 parts per million. Normally it's 200 to 300 parts per million. My hands are red because of that. So you can rest assured that restaurants are safe. We recognize that we are an essential service and want to do our social justice for our community as well, being out there to provide food. As a matter of fact, we've been getting a lot of emails, Facebook messages, people coming to the restaurant to pick up curbside that are thanking us for being open and able to support our community and to provide food for them. As a matter of fact, one of the ways in which we're doing so is at Terra, we've instituted an online ordering and payment portal. So that way you can order online, put your description of your car, put the time that you'd like to pick up, and we'll call you when it's ready so you don't have to get out of your car. We'll even go as far as to put the food in your trunk, so my servers are practicing more than the 6-foot social distancing. We're not allowing people to come into the restaurant at this time. As I said, we're happy to be a part of the facial covering guideline. We feel that for you, the general public, needs to know that we're practicing and we're being safe. If you go to your Home Depot or if you go to the grocery store, we want you to feel the same when you come to our restaurants. So with that, I want to thank the Board of Supervisors, Dr. Wooten, Dr. McDonald. Thank you, everyone. Be safe.
Thank you, Jeff. And as Jeff has so aptly identified, what we are recommending are not facial masks, but facial coverings. And a napkin can be effectively utilized for that reason. So good afternoon, everyone, and welcome again to our county media briefing. Supervisor Fletcher has reviewed the public health officer order that was modified and with some additions submitted yesterday and revised again today. I just want to emphasize again that we are recommending the face covering, the cloth face covering, to prevent the spread. If individuals have very early symptoms and aren't aware of such, these facial coverings can decrease the spread of the droplets that are spewed when people talk, when they sing, or in some instances, the research is saying even as you're breathing. So we want to do everything that we can, and there's new research that supports this strategy. So regarding global, national, and state, as well as local statistics, as stated yesterday, globally, the world has reached a milestone for novel coronavirus infections with over 1 million cases. Today, there are 1,076,017 positive cases, which includes approximately 58,000 deaths. Nationwide, we are seeing 261,438 positive cases, which includes 6,699 deaths reported. As a reminder, the United States has now the lead of all countries with the greatest number of cases. Statewide, there are 11,206 positive cases, which includes 246 deaths. And today, the County of San Diego also has reached a milestone with over 1,000 cases. To be exact, 1,112 cases, which includes 17 deaths. The one new death that we are reporting today is a male in their late 70s. Now, of the 1,112 cases, which is 146 more cases than reported yesterday, 628, or approximately 57%, are between the ages of 20 and 49 years of age. 519, or 47%, are female. 585, or 53%, are male. 211, or 19%, of the total number of cases have been hospitalized. 85, or approximately 8% of the total number of cases, have been admitted to the ICU. And as a reminder, ICU cases are a subset of hospitalized cases. Lastly, the 17 deaths represent 1.5% of the total number of San Diego cases. Now, again, our sympathies indeed go out to the families and friends of those individuals that have been lost due to COVID-19 infection. Regarding outbreaks, we are reporting 13 confirmed outbreaks in either congregate or community settings. We have one additional outbreak in congregate facilities for a total of 8, and one new community setting for a total of 5. In both situations, individuals are isolated, as they should be, and are not hospitalized. We are well aware of the media's interest to know all of the details regarding cases and outbreaks that we report. Public health jurisdictions are, however, bound to uphold the confidentiality of all cases reported to the local health department. And we really do have to weigh how much information we give out so that the public can take and action versus making sure that we maintain confidentiality and do not breach that. And that is a primary goal. So this action is governed by the California Confidentiality of Medical Information Act, or CMIA, which is codified in the California Civil Code, Section 56, and is intended to protect the confidentiality of individually identifiable medical information obtained from a patient by a healthcare provider and reported to the health department. So I, in closing, would like to thank all of the individuals, organizations, businesses, and governments for all that you are doing to help flatten the curve, which you've heard so much about over these past several weeks. All of these actions are to flatten the curve so that we can slow the spread of COVID-19, so that we do not overwhelm our healthcare system, and so that we can push things down the road until vaccines can be developed and antiviral medications can be developed. We thank everyone so far for what you've done, but we are asking you to do more based on the orders that have been issued over the past 2 days. And this is particularly for the next several months, but particularly for the month of April, as you've heard about the April challenge. So I would like again to thank you, and now welcome back to the podium Supervisor Cox.
Okay, we're going to get right to the questions. We only have one phone-in call today, so we'll go ahead and deal with that first, and we'll get to the text questions. Again, for the caller, if you're not identified by name and outlet when you're introduced, please make sure you identify yourself.
NBC7, please state your name and question.
Hi, my name is Nayela Charles. I'm with NBC7. My first question is, does the county anticipate having enough healthcare workers, such as pulmonologists and respiratory therapists, to staff the additional ventilators coming in?
Okay, Dr. Wooten will answer that question.
Well, I will start out, and then I'll ask Robert Seals to come up. Each hospital has a plan of how many healthcare workers, the supplies that they will need, and they work very closely with Robert Seals, who's with our County of San Diego Public Health Preparedness and Response Branch. So I would like to ask Robert to come up.
Yes, we have, as Supervisor Fletcher showed, we have about almost 100, somewhere in the 90s, ventilators ready to go. And these are backups to what the hospitals have in store and that they're using constantly. When they exhaust their resources, that's when our group steps in. So they will be using their pulmonologist, their respiratory therapist, and we will be supplementing with our equipment. As far as the numbers that they have, that would be a question for the hospitals. Thank you.
Okay, we're going to go to the text questions now. The first one is dealing with mail and packages that are delivered, and Dr. Wooten will answer that question.
Thank you, Chairman Cox. This is from Mario Escovedo from Channel 8. Can you confirm cases of COVID-19 at the UPS location on Boswell Court or other UPS offices? UPS is not confirming cases citing privacy reasons, but shouldn't the public be informed when these packages are being delivered around the county?
Well, newsflash, packages that were delivered before COVID-19 had germs on them. So this is not the first germ that is being detected on packages, and we don't know that that indeed is the case here. As I think was cited in an earlier media briefing, you should wash your hands, and I've stated this many times, numerous times. Even with the virus being on your hand, it cannot infect you unless it gets into the respiratory system. So after you handle packages, after you're out in the environment, touching knobs, ATM keypads, pins that you sign for when you're paying for food. Wash your hands afterwards so you do not spread the virus. And it's not just with COVID-19, it's with other viruses that are circulating, particularly during this time of year.
Dr. Wooten, I think
Oh,
you can answer
and
this
let-
next one.
And I have one other piece there. During my opening comments, I talked about confidentiality. So it is not our role to deny or confirm locations, business locations. It is up to the business to do that. But this virus is throughout the entire county, so no matter what segment of the population you are from, we are going to see individuals from all segments, from all sectors infected with this particular virus. So what we want people to do is to follow the guidance that we've provided. Wash your hands, keep the 6 feet separation, and if you have to go out in public, wear the face covering, but we really want people to stay at home.
And this next question, Dr. Wooten, you can probably answer. This is from Gary Worth from the Union Tribune. There's been some reports that the 6-foot requirement isn't enough. Has there been any discussion on the county level about making a change?
I've seen at least one article or heard about one article watching CNN. But until we get evidence and research that shows we should be having more than a 6-foot separation, we are adhering to CDC and the California Department of Public Health guidelines. Again, in addition to the 6 feet separation, we now are advocating using the facial coverings. So again, those are the actions that we are recommending.
Thank you, Dr. Wooten. Actually, I think this one is going to be for Rob. Yes, this is from Monica Dean from NBC7, talking about the distribution of PPEs, specifically the N95 masks, and these items going directly to emergency rooms and ICUs. Who decides how these items are distributed in the hospitals? She's trying to understand why nurses or doctors outside of the ER and ICU report not seeing an influx of new supplies.
The supply chain. When a hospital supply chain for their normal PPE acquisition is cut off or run dries, that's when the hospital incident command systems through their logistics officer will submit a resource request to the county. And we will work with their hospital incident command center, and we work with a group of hospital emergency managers year-round. We call it the group's called the Healthcare Disaster Coalition. There's some very incredibly professional individuals that we practice this and we work this year-round. And so that resource request comes to us, and we fill what we can. And if we can't fill it, we work with them to get it up to the state, and we, say, hey, this is low and we need this. And then the state provides additional resources. And then we send it out to the hospitals. What the hospitals do, they extend the life of the PPE, and they are doing everything that CDC and CDPH allows them to do in order to provide for their healthcare workers. But we are in contact with the Healthcare Incident Command, and they send us a resource request, and we fill everything that we can, and we get it to them in a timely manner. So, thank you.
Thank you, Rob.
This next question is going to deal with the prevalence of COVID-19 among different races, and Dr. Wooten will be answering that question.
This question is from Maya from the Voice of San Diego. Early data in several states has shown that certain races have disproportionately contracted and died from COVID-19. Can the county provide cases broken down by race to see whether there are similar disparities in San Diego?
So it is our plan to ultimately do that. With the data that is collected, we like to look at 5 lenses: age, gender, geography, race and ethnicity, and socioeconomic status. We don't have that information to share today, but we will be looking at race and ethnicity. But I'd like to remind everyone who's listening that the early cases for COVID-19 were travel-related, people that had traveled to China, to Italy, to other nations outside of the United States. And in that particular situation, these individuals are more affluent than the general population. As the disease becomes more community-wide, then that's where you can look at who is also additionally infected, and that depends. And as everyone is aware, that we prioritize testing to those individuals that are older adults, to those individuals that have underlying medical conditions, including heart disease, chronic pulmonary disease, asthma, or diabetes. And obviously, those conditions are more prominent in lower socioeconomic groups and older adults. Individuals with compromised immune systems are also prioritized for testing. On the flip side of that, very early on, we asked individuals that were older, those vulnerable populations, to stay at home. And we believe that call to action has been very helpful and has worked in helping to decrease the spread of COVID-19 in those populations, and thereby decreasing hospitalizations and death. But as answering specifically the question about race and ethnicity, we do hope to get that information out.
Thank you, Dr. Wooten.
This last texted question that we have is about restaurants and their operations, and I'm going to ask Jeff Rossman, who's the president of the San Diego chapter of the California Restaurant Association, to respond to that question.
And this question is from David from Channel 8. Have any of your small business owners expressed frustration trying to apply for small business loans at their credit unions? Do you have any idea what the problem is? And this is for applying for the Paycheck Protection Program.
Yeah, the PPP, SBA. I know personally, my dad is my partner personally, we had some issues this morning and late last night trying to log on and to get information. We've been in contact with our organization, our banking organization, and they're having issues on their end. So as far as an organization goes, I haven't had the chance to talk to anyone else, but personally, yes, it has been a little cumbersome and trying so far.
That concludes our questions for today, but before we leave, just a couple of things I wanted to acknowledge. Number one, I want to thank once again the San Diego Restaurant Association for stepping up during this crisis. They've been tremendous partners, and we really do appreciate everything that they're doing in order to help people get food from restaurants. We want to keep them alive, and we want to keep them busy, but at the same time, obviously, we have new rules that we have to abide by, and they are doing a great job in abiding by those rules. I know this virus is changing our lives almost every day, and every day it seems like there's new guidelines or recommendations or orders. And I want to thank all of our businesses for cooperating with us. And I'll give you one example. This morning I happened to swing by the Sprouts store in Chula Vista at 3rd and J Street. Ron Cohn happens to be the owner-operator of that, and I have to tell you, I was impressed. They had everything organized, laid out, 6 feet tape marks to make sure people were standing where they needed to stand. They had somebody out in front of the store with a mask or a facial covering on their face and basically wipe down the shopping cart so that people could get a shopping cart that had been freshly disinfected. Offered them sanitizer as they went in and sanitizer as they left. That's just one example of what so many businesses are doing to go above and beyond the call of duty in order to assist us in implementing these guidelines and now these orders that are coming out. I'm confident that our essential businesses are going to heed our updated order and certainly adapt to the new realities. But it's also important for everyone to listen to all of our recommendations in addition to washing your hands and practicing social distancing. If you must go out, please wear some kind of a facial covering when you're out in public. Now, this is an N95 mask. I happened to find it in a disaster kit that I purchased a couple of years ago from the American Red Cross. These are what we want to save for the public health workers and the first responders. And I know that we had in the latest chart up there, we had 593,000 of those that have come in that are being made available for nurses and for doctors and for firemen and police officers and ambulance drivers. This mask was one that was made by my daughter 2 days ago. She basically got on Google and found a pattern that she could make in 2 different types, one for behind the ears and one with tie strings. And that's just one example. Again, the facial coverings that we're talking about don't have to be they should not be, frankly, N95 masks. They should be bandanas, they should be napkins from restaurants, they should be scarves, or homemade coverings that you can do yourself. And we're going to have some more information on what you can do in regards to that, some do-it-yourself tutorials that are including making facial coverings at home. You can go to our COVID-19 webpage at coronavirus-sd.com, and there's a pattern that's right there that you can do one at your own home for your own protection. So enjoy the weekend wisely, and even though it's a weekend, we're still going to be doing these press briefings tomorrow at 2:30 to keep you informed and up to date. And I'll leave today not with the normal live well, stay well, and to stay well, stay at home, but with what I think Dr. McDonald told us yesterday. And that is, when you leave your place, cover your face. Thank you. That concludes today's briefing.